So normally they get a standard physical and examination by the surgeon, and then we look at all their imaging studies, MRI scans, x-rays, look at their history, have they had treatments in the past, and if they've gone through the fairly conservative measures that usually help people, most surgeons would have to offer them an invasive surgical procedure. But at that point, if they're a candidate for stem cell treatment, what we'll do is then talk to them about the pluses and minuses, the less risk associated with that, the avoidance of surgery, and if they feel as though they want to go forward with that, we'll start that process. That process usually involves a needle that goes into the marrow of our bone, and that removes the bone marrow, and we take that up to our stem cell laboratory, and our PhD, Dr. Dan Grandy, who's worked with these cells for probably 25 years. He's the president of the World Congress on Cartilage and Stem Cell Research. He will purify those stem cells, so take the bone marrow constituents like the red blood cells, which carry oxygen, and the white blood cells, which fight off infection, and make constituents of our blood. He'll remove those from the milieu, and he'll just purify the pure stem cells that are available in our bone marrow. Those pure stem cells then get injected with a small needle into the areas of the spine where the problem is coming from, the disc, the joint, etc. And so it's a two-step procedure, a needle to remove the cells, they go to the lab, they get purified, and then they get re-injected into the area where the problem is to try to stabilize the spine.